We want to welcome everybody to our webinar today. My name is John Michael Carter. I'm the CEO of ChartSpan. Delighted for you to join us for this 5 or 10 minute webinar today. I'm also delighted to welcome our guest, Don Self from Don Self and Associates. Don, you've been around for 30 plus years and notably have a lot of FQHC and RHC clients that we're going to focus on today. Well, thank you for joining us.
Thank you.
All right, I want to talk about what we're seeing with chronic care management programs and COVID-19, and then we're going to address $100 million awards that Health and Human Services has just made to HRSA organizations, and we're going to talk about those awards and how those can be used with chronic care management programs. Quickly here, 6 data points that we think many of you would value. Over the last 2 weeks, obviously, as the largest provider of chronic care management solutions in the country, we've been monitoring our patient population and their reaction to COVID-19. Of course, most of them are elderly Medicare patients. We've seen a 30% increase in enrollment over the last 2 weeks. That's certainly not surprising, as patients are trying to stay out of doctors' offices, hospitals, and ER, and we've become the first line of defense. We've developed clinical screening protocols that allow us to lessen the burden of providers. Frankly, 95% of all patients we screen don't have the coronavirus. So what's not happening, which is a big benefit, is those patients aren't coming in and clogging up waiting rooms and unnecessarily burdening providers who are frankly in triage mode, trying to deal with actual sick patients. That screening has also helped if you think about the safety of the clinical staff and the actual sick patients that need to be seen, because we're not sending patients in there who don't needlessly need to be there or may be sick and need to be triaged in a different way. Many of our practices have frankly closed their doors temporarily or only seeing patients virtually. They've got staffing shortages. So their chronic care management program has given them another venue to help manage the volume of patient inquiries that are coming in. And I know many of our customers are thankful that they've got their CCM program up and running during the COVID-19 outbreak. And then finally, and frankly, we're spending a lot of time with patients just addressing their fears, their emotions, the behavioral side of this outbreak. Certainly, elderly patients are the most vulnerable and the highest at-risk patient population, and we're spending significant time with them just addressing those concerns. I think our average patient phone call has increased by 20% over the last 2 to 3 weeks as we tackle patient concerns around the coronavirus. All right, I want to jump into the Health and Human Services Awards, $100 million for HRSA organizations, primarily 1,400 FQHCs and RHCs around the country to use for the COVID-19 outbreak. There are 3 specific areas. Actually, before I get to that, let me just say, in regards to knowing whether or not you are eligible, if you go to HRSA.org, you can see this interactive map, click on your state, and if you are listed, it will show you. It's a terrific interactive map that'll quickly let you know how much you've been awarded and if you've been awarded. As I mentioned, there are allowable uses of funds. There are 3 specific areas: to prepare, to prevent, and to respond to COVID-19. Don, I want to bring you in here. Obviously, you've had your head down dealing with a lot of your FQHC and RHC customers. What are you hearing and seeing from them as they manage the COVID-19 outbreak?
Right now, I'm hearing a lot of them panicking because patients are not coming in. Say, for instance, they're located in a city like San Francisco where everybody's on lockdown. Patients are not able to get in, and they're worried about their patients. And patients don't have a way to be able to get to the doctors or get the help they need. So that's where chronic care management comes in amazingly, as well as the different telehealth regulations that's being passed as part of the Emergency Relief Act.
So Don, for those practices, it's really a double-edged sword for them. One, they're worried obviously about their patients and how do you manage patients? And then 2, they've got serious cash flow problems now, because now you're not seeing the traditional volume of E&M encounters you'd expect.
Huge cash flow problems because they're having to lay off people. And just this week, I've already received 3 notices from clients who decided to retire early.
Well, so let's then talk about the use of these funds. I think the average FQHC RHC got about $70,000. There were some as low as 30, some as high as 300,000, but on average it was about 70,000. Here's the message we want to get out today for RHCs and FQHCs who are managing COVID-19. The funds can be used to stand up a chronic care management program. And those funds can be used for things like your service fees or the data fees that your EHR may charge you. So that really then addresses that double-edged sword we talked about. It gives you a program that allows you to manage the volume of triage patient concerns that you're dealing with, but it also becomes a predictable cash flow item for you, because Medicare may not pay the most, but they're certainly the best payer in the country. And you generally get those funds within 10 to 15 days electronically from billing. So at a time where you've got a lot of uncertainty and a lot of cash flow concerns, standing up a CCM program and using these awards to do so gives you some financial certainty. And Don, I would expect many of the clients that you manage would welcome that.
Amen. They will. I think they're excited about what you're doing right now.
Well, we appreciate that. One of the things that we're well aware of is that standing up a CCM program can have obstacles. And so what we did on Monday was launch our COVID-19 Rapid Response CCM program. Essentially, we've removed all the traditional barriers you see in running a program, so much so that our commitment to FQHCs and RHCs is that we'll get you up and running in 24 hours once we have access to your EHR. We are going to waive any long-term agreements. We'll allow you to just go month to month. We're going to waive any sort of patient panel size restrictions. So whether you have 10 patients or 10,000 patients, we'll treat you the same. We'll get you up and running in 24 hours. And then we don't want to send folks on site. We don't want to risk infection. Safety is a concern. And frankly, we know a lot of practice locations are chaos right now. So we've developed remote training and onboarding so that we can successfully train your staff and get you up and running in no time at all. Dawn, I might ask you to speak to the fact that we've worked with you, you've worked with us, you've got a lot of your customers who use us. Maybe just unapologetically an endorsement of what your experience has been like working with us and what your clients say about working with us.
Well, everybody from Dr. Sani to Dr. Akati and every one of my clients that are using you guys are just ecstatic about what you're doing. You're able to provide something to their patients and to their practices that they cannot do on their own successfully. And I got to tell you, y'all have gone above and beyond. That's why I sing praises to ChartSpan every chance I can.
Well, Don, we appreciate it. Thank you very much. If you have any questions, certainly reach out to your regional vice president or just send me an email at info@chartspan.com. We'll react within minutes once we get that and reach out to you either via email or phone call, and we can talk more about it. Don, we appreciate your time and we appreciate everything that you do. Thanks for joining us today.
Thank you, John Michael. Have a blessed day and don't lick any doorknobs.
You got it. Take care.
Bye-bye.